Hi everyone, Dr. Mika here again. If you're new on this channel, welcome. Please click on the subscription button, turn on your bell notification so that anytime I drop videos, you'll be notified. Like and share this video. Please subscribe. Last week I was talking about stroke, but in this video, I'll go deeper to discuss about the types of strokes and the management. We know about ischemic type of stroke and hemorrhagic stroke. When I think about ischemic stroke, I think about five major causes. We can see ischemia or a blood clot, which leads to the reduction of our blood flow into the brain. Thromboembolism, um, intracranial atherosclerotic disease, lacuna, watershed, cardioembolic are five major causes that we would be evaluating in this video. We would look at these different types of strokes, the signs and symptoms of patients' presentation at the emergency, the size of the lesion that you see on CT scan and MRI. Our embolic stroke, cardioembolic, and thromboembolic are as a result of blood clots, either from the heart or from the carotid artery that travels up to the brain and dislodges there. So you see a larger blood vessels, you see a larger blood clot that travels and then get dislodged in the brain. On the CT scan, you see a larger territorial impact or an infarction or a brain attack on the CT scan and the MRI as well. That is what you see in this type of stroke. So patient symptoms and clinical findings about this um, larger territorial ischemic lesion keeps us worrying as physicians about embolic phenomenon, that when you look at the images, the CT scan and MRI, you see a larger territorial impact or infarction or an attack of the brain. Arteriosclerosis disease is hardening of the blood vessel plaque. Arteriosclerotic plaque, atheroma forms on the blood vessel and it can form anywhere in the cerebrovascular system, out of the distal blood vessels or the medium-sized blood vessel or even the proximal major blood vessels in the brain. So we can see strokes of any size or any territory. And that is why atherosclerosis is one of the etiology we would be discussing in this video. Lacuna strokes are small vessel strokes. A lacuna is an island. This is an island of strokes deep in the brain, often happen in the subcortical gray matters or white matter tracts. The small strokes happen on the blood vessels, the perforators. We think of the thalamus striatus as the perforator or other small vessels in and around the brain can lead to a lacunar strokes. And one of the risk factor is long-standing hypertension. And that, again, we will discuss in this video. So what about hemorrhagic stroke? What should we consider when thinking about hemorrhagic stroke? Well, again, just like there are five causes of ischemic stroke, there are also five causes of hemorrhagic stroke that I would like you to think about. First, hypertensive hemorrhage is the most common cause of hemorrhagic stroke. Secondly, is hemorrhagic transformation of ischemic stroke. That we shall discuss in greater detail so you'll understand that even after ischemic stroke, there can be bleeding as well. A certain brain tumor like brain metastasis as well as primary glioma can equally cause hemorrhage. Vascular malformation in the brain, for instance, arteriovenous malformation, an aneurysm that can, burst or rupture and then bleed, you know. Amyloid angiopathy, which is a degenerative disease, is a condition that a patient will develop amyloid dementia. And we consider any leaking of blood vessels in this condition as a risk of lobar hemorrhage. Again, when we think of type of hemorrhage, there are two types of hemorrhagic strokes. There is intracerebral or intraparenchymal hemorrhage, and we have the subarachnoid hemorrhage. But you see, the hypertensive hemorrhage, transformation hemorrhage, the brain tumors, and the angiopathy, the amyloid angiopathy, these four are all in intraparenchymal or intracerebral hemorrhages. Okay, but aneurysms are the etiology that is really present in the subarachnoid hemorrhage. Those are the two causes of hemorrhagic stroke. What we do from the diagnostic standpoint for ischemic stroke is quite different from the one of hemorrhagic stroke. For ischemic stroke, we're looking at why the clots may be there. And for hemorrhagic stroke, it has happened. So there is bleeding already. What we try to do is to ensure that it does not get worse, so it doesn't bleed further. Now, patient will be required to do a non-contrast head CT at the emergency just to check expansion of the blood or the bleeding. This usually happens between 6 to 24 hours after the whole incident had occurred. Now, if there are need to further investigate clinically, an MRI may be, considered, and when you are looking, especially when you're looking for a tumor in the brain, the vascular imaging or angiography, some types of invasive or non-invasive angiography, when you're looking for a vascular lesion in the brain. We also look at managing the blood pressure as well in order to reduce the risk of uh, expansion or further expansion of the hemorrhage or the bleeding. And so the treatments are also very different. So we just oppose the treatments of ischemic stroke and hemorrhagic stroke. For ischemic stroke, we give antiplatelets and anticoagulants. But for hemorrhagic stroke, there's nothing we can do as such because the bleeding has occurred. So we just try to ensure and manage the patient rightly to make sure that the bleeding doesn't expand. So we hold antithrombotic and stop anticoagulants. For patients that are admitted in the hospital, we do not give those as prophylaxis. And we also use a compression devices. Okay. So patients sometimes develop seizures. We are also managing those potential side effects, particularly hemorrhages that involve outside cortical surface and gray matter. We are very, very keen at managing those patients. And we also do some investigations again, such as carotid ultrasound, transcranial Doppler. We do transthoracic echocardiograph just to ensure that we manage our patients rightly. So, stroke is an emergency. Do not waste time if you see any patient with stroke. I hope you enjoyed this video. Please take just 1 minute, click on the subscription button, click on the bell notification as well, so that when this video drops, you'll be notified. Thank you for watching. See you in my next video. Atutale.